Hello, today we'll be learning about implant related complications. Disclaimer: the given information may not be verified exhaustively by experts. Now, complications are mostly rare and can be avoided if one goes for a 6-monthly checkup. Most of the complications are manageable, only few are debilitating. Complications can reach from mild to severe, and some complications can cause implications, and rarely it may lead you to a lifetime of debilitations. So please go through this list carefully and choose your treatment wisely, and ask as many questions by mail or at the time of appointment as possible. List is exhaustive, not to frighten you, but necessary for informed consent. The doctor must be informed whenever patient experiences any of these complications. Coming on to classification of implant related complications. Number 1 is while implant is being placed. It can be intraoperative complications. Number 2 is after the implant is placed, which is called as post-operative complications. It is divided as immediate and late. Now please note that the cost of management of complications, if any, is not covered in treatment charges. Minor complications though may not be charged. Intraoperative complications can be divided as follows. Number 1 is hemorrhage, which is escape of blood from ruptured vessel. Number 2 is nerve injury. It is highly uncommon and can have its own set of complications and sometimes lifetime of debilitations. Number 3 is perforation of maxillary or nasal sinus. It is highly uncommon and manageable. Number 4 is jaw fracture. Number 5 is damage to adjacent hard and soft structures. Number 6 is accidental swallowing of foreign bodies. Now, post-operative complications can be further classified as number 1, ecchymosis, which is discoloration of skin due to underneath bleeding, and it mostly resolves itself. Number 2 is hematoma, which is swelling due to collection of blood. Number 3 is edema, which is swelling due to collection of fluid. Number 4 is emphysema, which is abnormal collection of air in body tissues. Number 5 is early infection. Number 6 is acute pain. Number 7 is Ludwig's angina. Now, particularly when surgery is done in the lower jaw, it involves swelling of the lower jaw and is generally an emergency. Land to the nearest dentist or medical emergency, whichever is available. Late post-operative complications. Number 1, implant failure. Number 2, implant screw fracture. Number 3, chronic sinusitis. Number 4, chronic pain. Number 5, late infection. Number 6, peri-implantitis, which is infection around the implant. Number 7, screw loosening. Now, intraoperative complications are explained as number 1, hemorrhage, which is escape of blood from ruptured vessel, the chances for which are minimal. Number 2 is nerve injury, 1.7% to 43.5% chances. For temporary alterations, and from 5% to 15% chances for permanent debilitations over 1 year after surgery. Perforation of maxillary or nasal sinus, 2% to 11% is the chances for occurrence. The chances are minimal. Now, due to missing teeth, sinus grows into the region, causing loss of bone, which needs lifting of the sinus in that region for implant placement. Rarely it may lead you to lifetime of debilitations. Number 4 is jaw fracture, the chances for which are minimal. Now, patients suffering from diseases like cancer on bisphosphonates, osteoporosis, or having severely resorbed ridges increases the chances of jaw fracture during implant placement. Rarely it may lead you to a lifetime of debilitations. Number 5 is damage to adjacent hard and soft structures, the chances for which are minimal. Rarely it may lead you to a lifetime of debilitations. Immediate post-operative complications. Any of the following may occur alone or in combination. Number 1 is hemorrhage, which, as explained earlier, is escape of blood from ruptured vessel, the chances for which are minimal. Number 2 is ecchymosis, which is discoloration of skin due to underneath bleeding, and hematoma, which is swelling due to collection of blood, the chances for which are minimal. Now, edema is swelling due to collection of fluids, the chances for which are minimal again. Response of the body due to bone augmentation can sometimes cause edema, which usually settles in 72 hours. Number 4 is emphysema, which is abnormal collection of air in body tissues, the chances for which are minimal. Number 5 is early infection, the chances for which are minimal again. Now, particularly in a single implant, crown can become loose and come out repeatedly. Coming on to late post-operative complication. Presence of long-standing uncontrolled systemic disease lead to delayed healing, causing the following alone or in combination. Number 1 is implant screw fracture, the chances for which are minimal. Now, risk of fracture of implant screw is 1% and abutment screw is 2% respectively. Imbalanced occlusal forces usually cause loosening followed by fracture of the implant screw. It may sometimes not be correctable and may require to be sacrificed. Number 2 is implant fracture, the chances for which are minimal. Number 3 is chronic sinusitis, the chances for which are minimal again. Number 4 is bone loss. Number 5 is chronic pain, the chances for which are minimal. Number 6 is late infection, the chances for which are minimal again. Number 7 is peri-implantitis, which is infection around the implant, the chances for which are minimal. Number 8 is screw loosening. 0.62% to 2.29% is the frequency for occurrence, the chances for which are minimal. Some people have more chances of screw loosening as compared to others. Particularly in a single implant, crown may become loose and come out repeatedly. If a patient observes the crown over the tooth is mobile, it is important to visit the doctor and inform about it. Regular checkup is mandatory as and when advised. Implant failure. Now, investigators found that 2 failures of 129 dental implants for a success rate of 98.4%. Failure rate for implants is about 2 to 5%. And some types of implants have failure rates up to 10%, particularly immediate loading and one-piece implants. Now, risk factor for implant failures are number 1, implant related, which can be due to implant material and surface. Then there is host or patient related, which can be due to bone quality and quantity, smoking, parafunctional habits, systemic factors, diabetes, age, host response. And implant failure can be at 2 stages. A, when implant is placed. Now, the possible reason is bone not being adhered to the implant. Risk factors that come into play are the 1 and 2 points that have been explained earlier. And B, after few years of implant placement. If you are diabetic or a smoker, then life of an implant is substantially compromised. Number 8 is TMJD, which is temporomandibular joint disorder. It can happen in all dental procedures. If it happens, it can cause varying set of problems. The list of complications due to TMJ is very exhaustive and patient is encouraged to go through the list which is available. Now, misdiagnosis during procedure and anatomic variations can always through misjudgment and may happen at the hands of an experienced dentist. Coming on to accidental swallowing of foreign bodies. So, specialists have determined that if swallowed accidentally, 87% of foreign bodies entered the alimentary canal, which is food pipe, while 13% aspirated into the respiratory tract, which is air pipe and lungs. The literature also showed that although 90% of ingested foreign objects could pass through the stomach uneventfully, there are roughly 10% that requires endoscopic removal. In this procedure, an instrument is introduced into the body to give a view of the internal parts. while still 1% will ever require operation. Accidental swallowing can cause serious complications and can eventually even lead to death, particularly if it goes into air pipe. Patients with pregnancy, obesity, sliding hiatal hernia are also at greater risk of aspiration or ingestion of foreign bodies. Immediately inform the doctor in case of accidental ingestion of foreign bodies. Early detection and intervention seems important for success. Every 6 months, patients must visit the doctor for a checkup. Otherwise, if there are any warranties, they will not be valid. Overall, the chances of complications are minimal at the hands of an expert, but technical possibility always exists for a complication to happen. This is for your information only. Although this is an exhaustive list of complications, a complete list is impossible to make, and there may be certain complications waiting to happen which are not yet listed in the literature. If you have any further questions, please write back to us by mail. Thank you.